Good evening. My name's Jim Stanger on a cold Australian winter's night, and I'd like to do a very quick video on a paper that was published today linking the endometrial thickness and the risk of ectopic pregnancy. This paper, produced by a series of Iranian authors, did a systematic review and meta-analysis on a possible link between endometrial thickness and ectopic pregnancy amongst women having IVF. So it's just basically ectopic pregnancy is one of the most hazardous obstetric complications and the most prevalent cause of maternal deaths, particularly during the first trimester of gestation. The incidence of ectopic pregnancy is reported to be 2 to 3 times greater in IVF pregnancies than in the general population. And this elevated risk has been attributed to numerous factors, such as the reproductive characteristics of infertile women, the utilization of assisted hatching, high transfer volume, deep fundal transfers, the time of embryo transfers, changes in endometrial receptivity, and multiple embryo transfers. And we're going to focus on the second last one, endometrial receptivity. Several studies have investigated the correlation between endometrial thickness and the occurrence of ectopic pregnancy. However, the exact predictive value of the endometrial thickness for ectopic pregnancy remains inconclusive due to the contradictory results and the heterogeneity of endometrial thickness measurement protocols. But they looked at several studies, and as you can see here, there are 4 studies which did suggest there was an association, but not a highly significant one, and there were 3 that made no difference. So this is the result of their meta-analysis. And their conclusions were, in this systematic review of 20 articles, we investigated the association of endometrial thickness and early ectopic pregnancy in IVF, and most studies indicated that a thicker endometrium is associated with a lower risk of ectopic pregnancy. Mertinger, for instance, found that ectopic pregnancy was more frequent in women with suboptimal endometrial thickness. Their studies indicated that women with an endometrial thickness of less than 8 millimeters had a higher risk of ectopic pregnancy compared to those with a thickness of between 8 and 12 millimeters, although those with greater than 12 millimeters also faced an increased risk, which goes to show we don't really quite know what this data is showing. But however, there were several other studies that have shown a significant relationship between thickness and ectopic pregnancy. Patel, Tinady, and Alisson also reported no significant correlation with Tyndade, suggesting their results might have been influenced by the small number of patients. Ribery also found no substantial difference in ectopic pregnancy risk against various endometrial thickness in a cohort of 3,500 cycles. So really, with this sort of data, it's a little bit hit and miss. In this study, the authors performed a subgroup meta-analysis of 6 studies evaluating the effect of endometrial thickness on the risk of ectopic pregnancy without categorizing women by endometrial thickness due to inconsistencies of categorization amongst the studies. And this is one of the real problems of meta-analysis, is that studies were never designed to be part of a meta-analysis for this specific topic. Their pooled analysis supported the notion that increased endometrial thickness is significantly associated with a reduced risk of ectopic pregnancy. So it's not so much that the risk is caused by a thinner endometrium, but the thicker the endometrium, the lower the risk. This association may be attributed to the fact that a thinner endometrial lining reduces uterine receptivity, thereby increasing the likelihood of an embryo implantation outside of the uterus. The type of embryo transfer cycle, in particular, may also play a significant role, as fresh cycles have been associated with a high risk of ectopic pregnancy compared to frozen thawed, possibly due to supraphysiological hormone environments and impaired endometrial receptivity. In contrast, frozen cycles may improve embryo endometrial synchrony. Additionally, embryo-related characteristics, including embryo quality, ploidy and the day of embryo transfers, are also thought to be critical determination of implantation dynamics. High quality and euploid embryos are more likely to implant appropriately within the uterine cavity, whereas lower quality or aneuploid embryos may exhibit altered implantation potential, potentially increasing the risk of an abnormal implantation. The timing of transfers, such as cleavage stage versus blastocyst, may also influence uterine contractility and synchronization with the endometrium. So in conclusion, the authors argued the lower endometrial thickness may be associated with a higher likelihood of ectopic pregnancy in women undergoing IVF. However, given the observational nature of these studies, potential confounding factors, and evidence of publication bias, these findings should be and must be interpreted with caution. While endometrial thickness may have a role as an adjunct parameter in clinical assessment, it should not be considered in isolation. So my view of the paper, having quickly read it, is that it remains unclear from this paper whether there is a direct link between endometrial thickness and the likelihood of an ectopic pregnancy. IVF in its early days, such as with day 2 transfers, back in when I got involved in IVF in 1982, the ectopic pregnancy rate was about 10%. It's only about 2 or 3% now. Maybe a thin endometrium has a different microvilli movement that may encourage poor quality embryos, such as aneuploided embryos that fail to implant, could easily move around more or not move at all. Who knows? Just remember that a transfer with a thin endometrium, if you plan to go ahead, may have an elevated risk of ectopic pregnancy. And what you need to do is then counsel your client before the transfer of that risk and manage any subsequent pregnancy with a view that ectopic pregnancy may be an outcome. That's the only thing you can get from this paper. But an AI view of which I'm using all the time, I quite like using an AI for subject. When the endometrium fails to reach an adequate thickness of usually less than 7 millimeters, it is often a sign of suboptimal cellular differentiation. Research shows that persistently thin linings or repeated implantation failures are frequently associated with altered topographical profiles, meaning the microvilli either fail to form appropriately or the cilia beat and the microvilli movement required to catch, orientate, and secure the blasters is impaired. And remember, the microvilli in the uterus beats up towards the fallopian tubes in the follicular phase and very early part of the periovulatory period. That's designed to carry the sperm up in the uterus and up into the fallopian tube. So the movement of fluid in the early stages of the luteal phase is towards the fallopian tube, but as progesterone rises, the microvilli start to beat backwards. So any alteration in the microvilli thickness, which may be an indication of immaturity, may well either imply either there's little microvilli activity, or in fact it's still been the wrong way. So this short paper, I just moved my little mugshot out of the way, is a quick take on one paper. But my name is James Danger. I'm an embryologist with more than 50 years experience. These videos from my Third Aid YouTube channel are my attempt to bridge the gap between information you may need for your fertility treatment and the most recent publications available to your staff. I need to make a statement that I am not a medical person and this information is not medical advice, but it may help you in knowing what questions to ask about your treatment with your doctor, and maybe to help in understanding the advice you receive. And if you're a client going through IVF, about to have a transfer, and the doctor marks, and you ask your doctor, is my endometrium thin? Then you should say, what's my chance of ectopic pregnancy? And then your doctor has to give you clinical advice. If you like what I'm doing, please click subscribe, or say you like me, which I hope that you do, and tell all your friends about how good this program is. I'd like to stop there and thank you. So I understand IVF is a personal journey that involves the actions of many techniques and concepts and ideas and stuff. It helps to understand all aspects of that journey, and I hope this information may be of value. Tell everyone else in your clinic, etc., about this thing, because I like to give you good advice. And I like to say thank you and good night.